Stem cell therapy patient demonstration.
Dr. Keshwani, #1 doctor in Fort Bend County.
In a training session.
Michael is the CEO,
Vice President.
Vice President of the company,
Biogenics.
sorry. Josh Kennedy, running for Court 3 of Law. Mike's wife.
Viva Baje.
Viva
Viva Baje.
Actually, she's the Vice President of Asia. Thailand, Singapore, Guam, Philippines.
Oh, and here's our new district attorney. District Attorney Sean McDonald's Your Life on Facebook.
Mike, let me know when you have it.
Yeah, it takes about 4 or 5 minutes. So.
Okay.
I'd rather have you guys ready and then you wait for me so we can have the freshest cells to be injected. I don't want them to be live nucleated cells to decrease in potency. It will decrease in potency over time. So once it's thawed, it becomes liquid state, we're going to inject it. Right now, we're still frozen. And Doc, you do the same thing. You have your staff take the product, and we're going to thaw it for 4 or 5 minutes, as you know, and then we're going to inject it. She knows. Just stay in the office.
So Jay, tell us what kind of problems are you having with your knee?
This knee is very weak. It tends to pop out of the socket. And I just straighten the leg and I have to pop it back. So when that happens, it's pretty painful. So I'm hoping that this is going to help make it new again.
Have you had any x-rays, MRIs?
MRI, yes.
What does the MRI show?
It says it's fine. It's just stretched.
So that it's the, is it your the medial collateral ligaments, or is it your ACL?
Yes.
What?
Yes.
All of the above, or the ACL? What
I don't. They didn't tell me.
Probably
Just said
the ACL.
everything looked fine. Nothing was torn.
So they're not torn, but they're stretched.
Right.
Okay, Jay works out a lot. He's always I mean, he's very, very muscular. He's quite athletic guy. So he obviously he's got a strong knee, but he has a tendon, a ligament in there that's
Almost ready, Doc.
very
Another minute.
stretched.
Right.
And that would the stem cells should help that too, right? Because it's probably stretched and inflamed.
Right, so it would hit the inflammation and also the ligaments that are, it regenerate the ligaments.
Brand new.
You want it
Brand new.
You want to be like a baby again?
You need to have 1 billion cells.
You're
Ooh.
telling me.
I'll settle for 21.
Yeah, you
Listen,
need
That's
no,
only
1 billion cells.
800,000.
Yeah, exactly.
no non-steroidal anti-inflammatories for 2 weeks, and if you smoke, try to stop.
No, I don't smoke.
Okay, good. But avoid any aspirin, Advil, ibuprofen for 2 weeks. We want to keep the inflammation up, for the stem cells to work effectively. So decrease and stop taking any non-steroidal anti-inflammatories.
No leaves?
Stop no leave. And the sodium, don't take that.
You think you can do that? Does it hurt real bad?
Well, it's not
My
only that
elbows
part
is what
that
hurts
hurts.
every day. So we're going to
You'll
do
have to
that
stop
next.
that.
Take acetaminophen, which is not going to have
So
any
you have to take
anti-inflammatory
Tylenol.
properties. Tylenol, which is acetaminophen, works by a different pain mechanism. It's not going to have any anti-inflammatory properties, so take Tylenol or acetaminophen for acute pain. Okay? If you have any questions yourself, just call me directly. I'll do my part.
Okay.
Doctor, we're ready. It's in a liquid form. Let me stick this in your arm. If you have any questions about this therapy, you can call me directly. It's my cell number, okay?
Okay.
Have it on
My goal is to stop taking the leave.
If you have, well, you can't take it right now. You can start in 2 weeks. But
Well, I hope
this,
not to take
yeah,
it.
yeah.
Yeah,
you
then
know
you
what?
may not need it.
You may not
I'm
need
over
it. Call me, and let me
Yeah.
know how things are coming along.
Well, you're going to see it on Dr. Naz's Facebook. Everyone's going to know.
Well, I'm going to be back every 30 days to help Doc out with presentations and protocols. So,
Is alcohol affected if someone drinks a
yeah, you
glass
shouldn't
of
drink.
wine?
You shouldn't drink alcohol.
Oops, Jay.
Just a couple weeks.
He said shouldn't.
Yeah.
Yeah.
It wasn't a must.
Smoking is the biggest offense, and also non-steroidal anti-inflammatory is the second. Try not to drink too much for 2 weeks.
Dilly dilly.
Dr. De Leon says that in her practice in Bradley, she's done thousands of these.
Yep.
She said she charges anywhere from $5,000 to $7,000 for this treatment. So I think I'll just take this walk.
Oh,
Modest.
that's what work there too.
That's it. You ready?
Yep.
Okay, so the doctor is going into the joint
Yeah.
space,
Need more room, Doc?
and
Need more
apparently
room?
it doesn't matter whether she's going laterally or medially, inside or outside, as long as she's in the joint area, because she's going to be able to, the cells are going to be able to get to all the ligaments. There's a medial collateral ligament and lateral collateral ligament, ACL and PCL that
Done with the
and
pressure on there, Doc?
pretty much that's it.
We're done.
That was a perfect
I feel
rhythm.
great.
You look like a baby already.
Yeah.
Well, I always thought you looked like a baby.
To learn more, call 832-446-3206.